Limitless, yes.
Welcome to another edition of Fusion, everybody. This is yours truly, Dlife. This episode of Fusion, I'm doing it a little different. This episode, we are going to focus on men's health in terms of the entertainment realm, inside the entertainment entity, and also what could we do as entertainers, DJs, people in the limelight, people who are out there every night, what we could do to better safeguard our health. And also it's going to focus on men's health. We as men, there's that stigma. We don't go to the doctor. We don't do this. We don't follow up. We don't get regular checkups, all that. We're going to put all that myth to rest. I have with me tonight, I have my good friend, DJ BARRIE Hype, well-known DJ, MC, travels the world globally. I have my partner, my partner in crime on the Saturday show, Iron Voice, who is also a DJ that travels a lot as well. He'll be here, but we also have the expertise. And I can't do this without having the medical expertise involved in this. And I have Dr. Dwayne Thwaites, who is the leading neurologist for the Eastern Caribbean Seaboard. And he's also a good friend of mine, and he willingly participated in terms of co-hosting this episode also to put his professional take on certain things and giving us some good advice as well. So y'all buckle up, keep it locked, because this is not a one-part thing. I mean, it looks like we're going to have maybe 2 or 3 parts to this. And also I want to continue this along the way in terms of involving artists as well. All right, so keep it locked. Let's go. All right, well, let me do the formal intros. Dr. Dwayne Thwaites, meet BARRIE Hype.
What's up, BARRIE?
Meet Dr. Dwayne Thwaites. Just a little back history on Dr. Thwaites. He is the leading neurologist, the head neurologist for the whole Eastern Caribbean Seaboard. So when you talk about Antigua, St. Kitts, all those, that is the man right there. He also does something that I admire. He does right after Antigua Carnival. He puts on a clinic where he invites a lot of his doctor colleagues to come into Antigua, and they do free testing for men.
Nice.
You know, so it is, you know, and I said the perfect person for this would be this gentleman here, and he's also a good friend of mine, right? We do the breakfast fete in Antigua. So
on Sunday morning.
Yes. So he was going to give us both scopes in terms of, you know, being there in the element, and also knowing how to deal with it on the clinical side as well. This episode here, folks, is basically to discuss and get some pointers in terms of men's health, especially in the entertainment realm, right? Our space where the time to get checked, the responsibility as men to go and get checked, we just kind of put it off. So I wanted to get perspective on that in terms of, you know, let me start with you, BARRIE, one time. You know, as somebody who travels a lot, who does a lot, how do you balance it too?
This is who keeps me in shape. Look at right here. Look at right here. I am blessed because my wife also works in clinical research. So this is somebody who, prior to my wife, Dlife, I could tell you 2 times a year that I would always get sick. 2 times a year, religiously, it always happened. Just before Miami Carnival, because that's that whole summer run of the islands, then we're going into Notting Hill, then into Labor Day. So that's 8 hours there, 8 hours back, no sleep, constant ride. And so just before Miami, I would usually get sick. The next time I would get sick would usually be sometime around just after Jamaica Carnival, because I've now done that entire heavy schedule of Trinidad. And after Trinidad is this post-carnival, that post-carnival fete, whatever, into Jamaica, bam. And this is basically our bodies were just going at 1,000. Sorry, we were going at 1,000%. And our bodies basically said, that is it right there. Shut down. And the advent of having this amazing queen in my life is the priority of my health is very important. You know, she was like, when last did you get a full screening? My answer was, She said, no. That's an unacceptable answer. Got fully screened. We checked everything. Couple numbers were definitely not where we wanted them. A couple of them, you know, could be better. But a couple she says, nope, we need to do this. We need to do that. I went back home to St. Lucia to see my doctor at home with my results of my blood test. She immediately suggested A, B, and C. We brought our numbers down to where we want them to be. There's only one number right now which is still higher than we would like it to be, and that's cholesterol. But pretty much everything else, there's, you know, there's room for improvement for some numbers, but yes, need to work on that.
We're talking about the good cholesterol or the bad cholesterol? Bad. Okay.
Yeah. So, but yes, this is one thing that we definitely need to work on, and not just people in the industry, but as men. A lot of men were either scared to go to the doctor or we're just going to put it off. No, that's not happening anymore. That's an unacceptable answer. The term is, I am my brother's keeper. When I see my friends, how are you doing? And I'm not just asking about your physical health. I'm asking you about your mental health. How are you doing? How's the family? How are you keeping? You know, and when we were in a space with really, really good friends, and I've had this conversation, rest in peace, Ricardo Drew. I said, bro, I'm not in a good space. This is after my father had passed. And he said, bro, I'm not a professional, you know, but you should go and see somebody. And like most men, like, yeah, we'll get over it, whatever. And then a mentor sat down with me and says, no. Take your time with this. Don't let anybody tell you it's time for, you should be over this or you should be past this. That's absolute nonsense. Professionals will sit with you and explain to you how this process works. Mourning is a normal thing. This is the man who taught me how to be one. So obviously I'm going to miss it, not just because he's my father. And so mental health is just important as physical health. But I'm not the doctor here. I'd love to hear the doctor's perspective on this.
No, and that is so important, Barry and Dlife. If you notice, one of the things that he's talking about is the stresses on life. During that period of time that he's talking about where you're going, no rest, don't eat right, don't sleep right, you're just actively going, and we push our body as Caribbean men. We push our body to that extent for those periods of time that he's talking about. And guess what? Your immune system decreases. Your immune and response to activity because you're tired, you don't get the full amount of rest, you just sleep, you're always on the go. The body has no time to recuperate, and you're putting a lot of stress on the body. So of course, your immune system decreases, and that's what exposes you to all these diseases and everything like that. If you notice, back in the day, we used to say, get a full 8-hour sleep, get some good rest, because yes, those things help build your body, help strengthen you, and give you immune response to most of the diseases that we see nowadays. And so Caribbean men are affected by these things, and we take no look at these things. We just keep going, and we think we're the strongest people out there. And of course, during those periods, we imbibe a lot of alcohol, and it's just, and your body just can't keep going like that all the time. You know what I mean? And so after a while, you realize, look, I'm getting sick after all these events, and I'm glad he brought that right out. And this is a good way to start to look at the different activities that really affect us as men and as Caribbean men. And when we start to talk about things like prostate cancer and men's health, we realize that a lot of these are tied into the activities. If you notice, they used to have an event like after Trinidad Carnival, there will be a massive flu that affects all of us after the carnival, after the event. And we used to name these flu according to whatever got road march or what is the best song out there. So sometimes
yep, I remember that. Yep.
Yes, and we're not even checking, and we're young and we jumping and we liming. We're not even checking that our immune response has decreased considerably. We don't eat right, we don't rest well, we drink, we lime, we roll, we tumble, and so our body responses to diseases has decreased considerably. So that's why we catch most of these events.
So I have a question in terms of like with Barrie. So like what he says, he's consistently going, he's going. Now it's part of the job, it's part of the routine, right? What it is as from a medical standpoint. Now what I started doing now is making sure I try to get minimum 6 to 8 hours sleep every night. That is my goal. Sometimes if I get 5, I'll just be like, all right, I'll go take the 5. And that's because I'm up later editing or doing stuff, right? But I try to get that minimum 6 to 8 hours. What would you say, Doc, in terms of somebody who's on the road like him, somebody who's doing something like that? What is, apart from the nutritional part, the sleep?
Yes, and it becomes important again, and as we talk about, and as you grow up, the full 8 hours of good, what we call REM sleep, the deep sleep, which gets your body well rested, helps with your immune response. And you talk about nutrition, you talk about your vitamins. We as Caribbean people don't want to deal with no tonic. We are Superman. You got to take your vitamins, fresh fruits and vegetables. There you go. Fresh fruit and vegetables, you know what I mean? It is so important. And we have these things available for us, but we ignore them. And all we want to do is just drink to show that we can stay up and we can lie. But yes, it's very important that we get the full REM sleep for most of those times. If you don't get the appropriate amount of sleep, your body becomes weaker. Your immune response, even your antibodies and everything don't respond. They become sluggish because they can't keep up with all that activity. They also need a little bit of rest. You know what I mean? Your muscles, they break down the glucose, the amino acids that help build muscle. Those decrease considerably. So you don't have anything in terms of any kind of a body resistant to attack any virus like it normally comes to you on a regular day when you get your full 8 hours sleep, when you get your full sets of complements of vitamins, when you get your fresh fruits, your glucose intake, your protein, the well-balanced diet, because all of that is out the window when we're doing this. And I can agree with you, it's part of your job. You got to be ready to roll. So it's important that you prepare yourself for these activities. Hence, if you see, when it comes down to Trinidad Carnival, everybody start going in the park and exercising and getting your body up and building nutritionally. You're taking your vitamins, you're seeing your personal trainer, and everybody complains and talk about, oh, you're getting your body ready for Carnival. And in all essence, it is so important that we do all of this. This is one of the things I like about the Caribbean style event, because when it comes around to your event, people start preparing themselves 5-6 months down the line, and your government is like, oh, but not understanding you have to do these things to keep up with all the events, everything that's going, and it builds strength, it builds stamina. It not only prepares you for that event, but also when we look at your exams, your work ethics at school, your office, and all of these things, you prepare yourself for these, and this is how you work and deal with things. So Caribbean people in essentiality, not knock carnival down all the time, but we do prepare ourselves for these events, the long trips on the road, the parade. You have to be fit, you have to be physical. And you know, one of the things that I admire a lot about the Caribbean people, the pregnant women. You ever see them playing mass boss? They're looking good, but they prepare themselves for all of that. And now they jump in with 2 people. You understand? And they're on the street. So you gotta understand, but they prepare themselves. They take their nutriments, their vitamins, they go to their doctor and prepare themselves for these events, Dlife. And so it's important. We can say that it really takes a toll on us. But a guy like BARRIE and so who go in 6 and 7 carnivals, you understand? This is where it takes that lick for him. But you have to be prepared. You should be ready. And I like Carnival for that because people prepare themselves for these events with all these things. Nutrition, you get your good rest because you know you're going to put a load on your body during that whole week, 2 weeks of Carnival. You understand? So yes, it's important. It's important nutritionally to do your well-balanced diet, your little protein, your little vegetables. You know, we have some people who are vegan, who do what they gotta do, but we have to have that composition of well-balanced, a little bit of this, a little bit of that, and it helps you go a long way. The vitamins, the minerals, the good sleep, the exercise, the little activity leading up, because you're going to put a big stress on your body for that period of time, which can make you immunocompromised. And that's what happens to a lot of us. And that's why we get the kamikaze flu, this flu after Carnival.
Help me out with this. In terms of getting that nutritional value, not always you're in a place where you could get that. Sometimes you're in airports, sometimes, you know, the location where you're by is not really adequate where you could get a wholesome meal. What would you say in terms of being in that situation? What can you do as an individual?
Okay, and again, and nowadays, and let's go. You remember, a lot of the, let's say you're on the street, a lot of the masses that we play now are all inclusive. Back in the day, it was even more difficult to get a good meal. And these guys prepare some very good, well-balanced package. Your dietitian, most of the groups or troops that you play with have their dietitian, they have their people involved getting a packaged meal, well-balanced diet. On the fly, on the run, your vitamins, you take those with you. You have electrolytes. You have all kind of different things. The different nutritional drinks that are out there. You shouldn't be complaining of this on the road these days. You got your little deli that sells you these important drinks. Your little power packs. Your different things that everybody have a little pack. They have a 12-pack of electrolytes. So little water. You throw that inside. You get all the nutritions that you need. You know, one of my favorites, and a lot of people complain, and I like my Gatorade. I mean, understanding that, I mean, Gator coming out of University of Florida. You're down in Florida, right, boss man? Where Gatorade was made by University of Florida. And what they had done with those kind of drinks is they manufactured with the consistency of sweat. The sweat is what you push out during activity. So they made that, and they put the little vitamins and minerals and little things that you put out of your body when you sweat, and they use that to make yourself the consistency of Gatorade. Now, what the body push out can easily go back into your system. So when you drink the Gatorade, the consistency, it goes into your body in a quicker fashion than most other stuff, even quicker than water. And most people don't understand. They're like, how that can go in quicker than water. But when you drink a Gatorade, just a little bit of sugar, the glucose inside, the little minerals that they put in, the body likes that, and it just absorbs it. It goes right back across the system, what we call diffusion. right back into the system. So it is one of the ways of consistently getting those nutrients into the body in a quicker fashion. Now, most people will tell you, okay, you're dehydrated. Let me slap in a little bit of an IV fluid and get you back. When you drink a Gatorade, that is one of the quickest ways that you can get fluid right back into your system to build back up. The fastest way is really with an IV fluid. Pop.
Okay, I've seen people do that. I've seen people taking the IV. And let me bring in Iron Voice. Iron Voice just joined us. Let me bring in Iron Voice. Let me welcome you guys. This is Michigan Iron Voice. You should know him from the Saturday show.
Saturday show.
Right.
What's up, sir? It's a pleasure.
Unmute your mic. Unmute your mic.
Sorry about that. Good evening. Good evening. Good evening.
You want to keep that voice from us.
and Mr. Gordon, meet Barrie Hype.
Bless up, Barrie Hype. Bless
every
up.
time, every time.
And this is Dr. Dwayne Thwaites. Doc, you said Gatorade will absorb faster in your system than water.
Yes, it gets in there because of the little extra glucose and nutritional stuff. You know, water is good, it gets in. But with a little bit of glucose inside of it, the membranes of the GI tract, the villi and all of that, easily absorbs sugar with water in a quicker fashion than the water going into your system. Okay, for some reason it likes that, and that little nutritional aspect of it makes the water goes in faster. So it's good to rehydrate with and again, if you do the electrolytes, which have a little bit of salts and all that stuff, those things get absorbed quicker. So people will tell you first, if you're behind, IV fluid. And for me, my next option is electrolytes or with a little bit of Gatorade, because it goes right back into the system in a quick time, and it builds up your blood volume, with your water consistency, which is what you need when you're behind, especially when you're doing these long trips. You're going on the road for a long time, man. This is one of the good things. Good exercise, but you're losing sweat. Your body is losing water. You're becoming dehydrated. Now, what we need to understand is the principle behind sweating. When you sweat, you release the water, and that water have to evaporate from your body. And so in evaporating from the body, it takes the heat from the body and it goes with it. And that's how you cool down when you sweat. Same principle again. If you want that thing that you're losing back, Gatorade is good because it's in the consistency of sweat. So whatever you put out, the body can easily take it back in, and it's one of the fastest ways to get fluid into your body is with the Gatorade besides an IV bag dropping in boop one time.
Well, you just raised Gatorade stocks because I got to buy a case.
I just, oh Lord, you
just raised Gatorade. I go buy a case. Right? I mean, because I was good with my water, but you know that you're showing the Gatorade. All right, it looked like
Doc, quick question for you: If for example, the bar is out of Gatorade, but there's coconut water. We see a coconut water man on the side of the road. What's your take on coconut water?
Absolutely excellent. Again, we look at your percentage of sugar and your percentages of water. And the coconut water has glucose, lots of glucose, but also along with that, it has a lot of proteins and everything in the coconut water. Now, proteins are a little bit more difficult to absorb into the body than the glucose, because the glucose is already broken down into simple sugars, and then boom, they just slip across the membrane itself. With the protein, you got to break that down a little bit more into simple proteins and stuff like that to go across. So this is why it is better with a little bit of glucose. The coconut water is a little bit more higher consistency, so the degradation of that to get across the membranes in the body is a little bit longer, but yes, it is just as adequate, and you have a high percentage of water in that concentration. And so yes, that also will assist you, and coconut water is very good nutritional content.
So I have a question for that with the coconut water. Now, Barry is talking about the fresh coconut water, right, Barry? The vendor on the side of the road.
Mm-hmm.
The packaged coconut water,
Yeah.
is that a good substitute?
It is adequate substitute. Again, preservatives. One of the biggest things, and I always talk to my patients about this, is Caribbean people. We are accustomed to so much preservatives. Remember back in the day, this is where we get this salt fish, the pickled stuff, the all kind of stuff. Now, he laughing, you know, but the little fruits, all them prunes and stuff, everything is either sugar-based or salt-based.
Salt-based,
and then we start to look at the canned good stuff, which the nitrous amines and all of it. And this is why we are so exposed and changed, and all these things occur to us that are affecting us. But we have been raised, you know, the canned pork, the salt fish. We do a lot of things to preserve stuff. And that becomes a big problem for us. Now, the natural stuff goes in and works easily. Most of our diet is so based on all these kind of preservative, because we were in the Caribbean. When you raised up your poor country, you don't have much of any fresh things. So we used to have to preserve stuff. And again, we had no refrigerator and all that stuff. So we raised up in a rough. But times have changed now. We can get what we need off the street, which is fresh. I mean, some of it can be frozen. But back in the day, it was a piece of meat that was salted that we would just pick up and cook and eat and gone. You know what I mean? Or cornmeal turned, everything was in preservative because we didn't have all these electronic stuff now that is preserving stuff. So this is why we are predisposed to some of these. And that is why our diet without these fresh products becomes a problem for us. And this is why we see all these changes in terms of cancer and all this stuff that is coming. Is a lot of preservatives we were using back in the day because we were poor people. We didn't have the source. Your neighbor had the refrigerator, okay? And even the stove to cook, we didn't even know nothing about microwave and all this stuff. So we had to preserve the stuff. You go to the market, you get a little corn pork, you get some saltfish. This is why saltfish is a big thing in our diet. Now we can't even afford saltfish. You understand? We can't afford it. It is expensive. It is very expensive, but we used to do corn, and this is where high blood pressure with the too much sugar, the diabetes, you know what I mean? And then all these cancer products now with all these canned stuff, which they were preserving to give to us so that we can have them because we didn't have anything to preserve anything. So this is where we look at these kind of things that are affecting us in our lifetime all now.
Barry asked a question about coconut water because every time, you know, whenever I go back to Jamaica or any island, the first thing I want some jelly, you know what I mean? I want some, cause fresh, you know what I mean? So I'm really not a fan of the packaged coconut water. So I stopped drinking that. But so I try to make sure I make a trip down just to get that. Dlife is a much more decent person than myself now. Me, if I'm in a dance now, I go drink like a rum and them something there. And you know, especially when you're playing, that's gonna dehydrate you quicker. Because you're sweating, because I'm a selector also, so you're sweating and you're playing and then you're drinking the alcohol and you need to replenish yourself with something. But so it was interesting what you said about the Gatorade.
Yeah, and that's important again. But the coconut water, the ones that preserve, in order to keep it long on the shelf, they use a lot of sugar inside. Yes. So it is high on sugar content. So for us Caribbean people who have a lot of diabetes, this is one of the disease that affects most Black people in the Caribbean. When I talk to my patients, we ask them family history of disease. So high blood pressure, and we know that's rampant in the Caribbean again because of our salt productions, the salts that we use. Everything is pickled, your peanut, everything having some salt. So we are predisposed to high blood pressure, even though it's a genetic disease. And of course, diabetes. These things are rampant, high incidences in the Caribbean. Again, preservative, everything is preserved with sugar. Your date, the things that you eat, the stews, the tamarind stews, the All of them, you throw a bunch of sugar in order for these things to stay fresh. Well, they don't stay fresh, but in order to keep them in good condition, we use a lot of sugar. If you notice that around the Caribbean, everything sugar cake, sugar this, sugar that, and that is what preserves these things.
Stew chicken with sugar.
There you go. So and these things preserve, but it predisposes us to the diabetes. And these are, even though they're genetic, we are predisposed to this because we use a high abundance of these things, and that's what it is. So that coconut water that is there, I'm not hitting it. It has a little coconut flavor, but its sugar content keeps it current and keeps it up to date for a longer period of time. And that's what we see with all these things that we use. And that is because of our history of trying to preserve things so it can go for a longer period of time when you don't have the money to do these kind of things. And then reported, and it affects our disease components in the Caribbean itself. We're talking about things like prostate cancer, which is a very dear subject to me. And this is one of the things that Dlife had called me to ask me about, especially we have a couple of our great superstars who are just going down because of prostate cancer. Very, very prevalent in the Caribbean. When you're talking, one man is diagnosed every 3 to 4 minutes with prostate cancer worldwide. One man diagnosed with prostate cancer every 3 to 4 minutes worldwide. And in the Caribbean, those numbers are even more significant. And one man died every 18 minutes in the world from prostate cancer. So what I was saying, when Iron Vice came in there 18 minutes late, one man done dropped down from prostate cancer. You understand what I'm trying to say? So we take things in a little thing, but this is how prevalent prostate cancer is in the Caribbean. In the Caribbean in itself, we predominantly Black population. You know, we all integrated and mixed, but prostate cancer is 4 times higher in the Black population than it is in the white population, the Caucasian population. And so, and those numbers are even more significant in the Caribbean itself. We are in an epidemic state from prostate cancer in the Caribbean. Again, we look at these things and we all like jump up and we cool and everything. But, you know, for sure, when we look at what was happening there with your soccer star from Trinidad, in a quick time, he ended up with stage 3, stage 4. Prostate cancer. Yeah. Within a year, he had to be treated twice for prostate cancer. And he's a young fellow. You know what I mean? And so, yes, genetic predisposition, just being born Black, age becomes a significant risk factor, okay? And these things you can't change. You can't do nothing with your age, being born Black. You can't change that no matter what you think of, and no matter how much you bleach out or whatever. You can't change those history, and those are risk factors for prostate cancer, being born in the Caribbean. Some of the data that is out there when we look at prostate cancer, and this is one of the things that got me interested in doing and treating prostate cancer in the Caribbean. I just sitting down one day reading the textbook. Okay, I was up at University of Miami there reading the textbook on prostate cancer. We have this big book that we sit down and read. And they were talking about the demographics of prostate cancer, right? And they said, look, the high incidence of prostate cancer is up in the Baltic state, the colder places, Greenland, Iceland. I think Donald Trump wanted to take over Greenland or one of them countries up there. Those have a high incidence of prostate cancer.
Why
very
is that?
Higher than, well, again, everybody thinking maybe it's colder. I don't know the proper. If I could answer that question, I would be a millionaire by now, Dlife. But what I'm saying, the demographic, and then as you go further south, the incidence of prostate cancer decreases. And then the textbook say, but when you hit places like Jamaica, right, the incidences, and the Caribbean, the incidences go right back up. So as you come further south, you come down, you get to America and all that stuff, the incidence of prostate cancer drop. But then when we jump into the Caribbean, we see that it starts to go back up in Jamaica. And then as you go further south, it decreases considerably. When you look at a Chinese man in China, right, the incidence of prostate cancer down there is less than 1%. Very rarely you see a Chinese man with prostate cancer. But if you take that same, if you take that same Chinese man and drop him in America or in the Caribbean, his risk for prostate cancer goes up. So we start to think it's environmental, right? That if for some reason it must be environmental, because if you take him from one place and do it. And then when we look at Africa, we see a big high incidence of prostate cancer. Actually, one of the earliest studies on prostate cancer was done out of Tobago, where they brought a group from Pittsburgh to look at prostate cancer in Tobago. And when they looked around, they saw that the incidence, it was almost 13.5%, whereas in the US, it was like 3.2% incidence of prostate cancer, and it was 13 in there. And then when we did the research and we look at the data outside, we found out that most of the people in Tobago was of East African descent. And so that increases the risk. And then we see the same kind of a pattern back in Jamaica and through the Caribbean. And so we're thinking that these things are associated, and that's why we have such high incidence of prostate cancer in the Caribbean itself, is because of the roots, the African roots into the Caribbean. But this is one of the first studies that came out on prostate cancer and incidence in the world, coming out of a study out of Tobago itself. So the Caribbean people are predisposed to that. But when I was talking about demographics and the movement south, we know as you go further, it decreases again. And the Chinese, very rarely you see a Chinese man with prostate cancer. So there are a couple of things that you can't change in your lifetime, and those things predisposes you and make you at a higher risk for prostate cancer. Genetics, family history is so important. So if you have an uncle or a cousin or somebody with prostate cancer in your history, that means you are increased risk of getting prostate cancer. And for the females, if you have female woman listening to your program, we're looking at an association between breast cancer and prostate cancer. So the women with the BRCA2 disease, their brothers are predisposed to prostate cancer in this group of people. So we know that, okay? So, and if your brother has a BRCA2 prostate cancer, you are also at an increased risk for breast cancer. So these are kind of some of the relationship that we need to do. And it's
wow. Barry, you had a question?
Yeah, so based upon what you said, Doc, we have the Asian gentleman who living in China or Japan. You're saying that their chance of prostate, based on your percentages, a lot lower than us in the Caribbean. But
Absolutely.
However, when you move this person to the Caribbean, their chances and percentages go up. So clearly, what's in the lifestyle of the Asian diaspora that is different to what we're doing, or what are we doing wrong that the Asians are doing right, for lack of a better.
And it's very important. I'm going to tell you, because every time I hear the contra to this thing, again, we're thinking it's environmental, industrialized area, countries, the water, the food, the preservatives are all different in these parts of the world, different from what you have in China. But some people will tell you, they will say that, remember now, them Chinese, you go on Chinese market, you got everything there you can eat. And some of the plants and the herbal stuff that they use, also we think is partly important for them, and the risk factor. Their diet is completely different from what we have. in the industrialized world compared to that. And so we think that this might be some of it. But again, you're looking at environment and diet, your lifestyle changes, which makes it different and predisposes us to these kind of to prostate cancer and on a whole.
Which is a good point you make, because all right, here in New York, right? Everybody know New York is famous for Chinese food, right? Mm-hmm. And when you go in a Chinese restaurant and you buy Chinese food, I know I am voice to eat Chinese food no more.
No,
right?
no.
But when you go in a Chinese restaurant, when you see them eating, it is something not on the menu. You see something completely different that they're eating from.
Yeah, absolutely. They don't put preservatives in their food like that. Everything is fresh.
In their food, right. But the food
even the meat that they eat everything. Everything that they tell me something they don't eat, right? And that's what they were saying is important to the risk. And I'm just amazed that how low it is. You don't even go in China when you're doing your research and everything to ask about prostate cancer, because it's negligible. It doesn't really exist in those countries itself.
Wow. Which brings me, let me bring up one of the questions here, Doc. All right. At what age, all right, and I know that has changed over the years, at what age should you get a colonoscopy?
Yeah, I was just the other day. I mean, when I was training up in New York and Miami, we were looking at these diseases. It used to be at the age of 50, they asked you to get a colonoscopy, but now that number has dropped down to 45. And so now they're asking you to get a colonoscopy at the age of 45. For prostate cancer, they ask you to start screening at the age of 40 in a high-risk population. That is, if you're Black, you should start trying to get screening early at 40. If you have a strong family history, which is what we're talking about just a while ago, and you have uncle or whatever, you can start your prostate screening at the age of 35. Colonoscopy, 45. So those are some of the things that we need to keep in the back of our head. Now, what's important about the colonoscopy is that after 45, and if you're clean, they will give you a 10-year hiatus before you can go back and get another screening if you're clean. If they find any lesions inside on the colonoscopy, then they ask you to come back in 5 years and be screened again. But yes, the numbers are changing, and we're getting a little bit more aggressive checking for these kind of a disease entity. Again, as I said, diet and everything. Go ahead, Barry.
And I love the fact that you're focusing on prostate. What would you say is the next cancer in line that we should be paying attention to as Afro-Caribbean men?
Okay, and that would be colon cancer. Our number one worldwide, when we look at the number one disease killer of men, is lung cancer. Okay,
lung cancer.
Lung cancer.
Yes, lung cancer.
Okay.
Yes,
okay.
And so when we look at those numbers, I remember, Barry, when we were coming up, all of us were smoking a little cigarette here and there, and all these kind of things. And Caribbean people still do. Again, we do have a lot of fresh air, breeze blow through and everything, so it's good. Again, but we do still have a lot of Caribbean men smoking a lot of cigarettes and all that stuff. So
well, the hookahs and stuff is dangerous too now. These hookahs and these
all of them, those things. The hookahs embalm your lungs. It makes it, man. And it is, I mean, people look at it. You know how we go. But yes, the number one killer of men is really lung cancer. And then following right behind it, that becomes prostate cancer. As I gave you a couple of the data and the statistics that are out there. And this is globally, okay? And I think it's a little bit higher in the Caribbean, But again, this becomes very important. Again, important to all of us. Age, genetics, okay, and your descent, where you come from, okay, becomes important. and your race becomes important as risk factor. These are three major risk factors that neither you or Advisor Barrie can change. You can't change that. As I said before, no matter how you bleach out and try and look white, it don't change your incidence of prostate cancer itself. You know what I mean? Just being born is important.
And is the age the same for men and women to get their respective checks?
No, women, we don't do, when you talk about women, we look more at breast cancer, and it's a little 30, 35 is where they start looking at the screening for breast cancer. For men, prostate cancer is a little bit different again. And so we look at these numbers. Colonoscopy is the same for both men and women. That's the age where we start to look at doing screening for colon cancer. You have the Coloplast nowadays, where they just put a little stool in a little container and they can do a little check for you with that. That's done mostly in the US countries. And some people stick with those ones. It's easier for you than the colonoscopy. But these guys now are so good at doing these colonoscopy, they could do it quickly and less risk for you. And so it's important that we try and start to do these things as early as possible. I actually just got my colonoscopy done the other day. And, you know, I mean, I was happy to get that out of the way, and Dlife also. So, you know, we got to encourage Iron Voice and Barrie.
No, I got my first one this year. It was an interesting
experience. Good for you.
Yeah. But I did get one my first one. My wife made sure that exactly. You see, that's one of the things that get us to the doctor. You know, your wife.
They do not play.
No, they don't play. So I give thanks same way. But she made sure to nag me into the doctor's office, and I went and did it. But you know, it's one of the things that we have to make. Because honestly speaking, and I mean, I could speak for myself too. If I didn't have my wife, probably I wouldn't have gone yet. You know what I mean? I may have waited a little longer. But you know, that it really is a thing. You know what I mean? They really help us. You know, so yeah.
and you know, Iron Voice, as you say that, as you say, if it wasn't for your wife, right, you wouldn't go and check. It brings me to this question here. Somebody had asked me to ask, what are some of the symptoms we should never ignore as men?
I like how they reverse that. We shouldn't ignore. I mean, problems urinating, that becomes an important thing. Once you start to have symptoms passing the urine or even frequent urination, that's one of the things we look at and we check. Once we start to see those changes, we know that the prostate is beginning to affect you in some way or the other. So these are the symptoms. Now, most importantly for whoever wrote that question is that prostate cancer has no signs or symptoms, nunca, nada, wherever you want to do. When you start to have symptoms from prostate cancer, which is the frequent urine, the back pain, the blood in the urine and all that stuff, it's already late. It's gone to late stage prostate cancer. Hence, why we do what we do these days and we screen for prostate cancer. It's important to understand screening process. Screening process is done for most of us, for every one of us, because of the fact that when we pick up a disease in its early stage, we can cure you of the disease entity. So if we pick up prostate cancer at a very early stage, 95% of the times we can cure you of your prostate cancer. So it's important that we do this screening process because prostate cancer on a whole, 100% have no symptoms with the early stage disease. None, nunca, nada, you can't tell nothing. Your boy will tell you Dlife, because they pick it up at an early stage, you can jump in and treat. If we pick it up at a late stage where the patient becomes symptomatic, that is frequent urination, unable to pee, blood in the urine, back pain, you know, I mean, rib pain, can't breathe, then we know the disease has already spread out of the capsule, and that is when it becomes too late. Hence, we ask you every day, just like the colonoscopy, we ask you to go and get screened for the prostate cancer. And so that becomes very important to us because these disease entities have no signs and symptoms. Again, we screen for diabetes, we screen for high blood pressure. When you start to have symptoms from these things, it's already gone to a very late stage in this disease, specifically for prostate cancer. Early stage, we can treat.
Which brings me to this question here I had. What are some of the tests you should ask for? Right? Like you said, when you go for your annual physical, there's a series of tests you get done, like the HC1, all these different things, right? You get done. But there are things now that I am learning now, unless you ask for it, they don't do it.
Yes,
right?
and yeah, you guys are asking all the hard questions. So what we look at when we look at disease screening and disease tracking for people is that we try to look at the most common disease entities that we see, the one that affects your population in a very high percentage manner: diabetes, high blood pressure. So you will find that when you go to the doctor, those are the ones that they screen for. Things like pancreatic cancer and things, because they're less common. Unless you don't ask your doctor to do those things, they won't do that, because we very rarely, and when we do see it, it is a quick disease entity. So you can ask for a couple of other tests, a CA 19-9, which looks for colon cancer. You could ask for CRPs. You could ask for certain things. Once we see a variation in these numbers, then we start to look for diseases in those entities. But for just a general, this is why they call it a general check. We do a comprehensive look at a few of the disease entities that are very common. The very rare ones, we really look for those. We hardly ever do. And so this is one of the things that you can ask your doctor, especially if you know within your family or you had a close relative of yours who passed away from one of these other things, which are what we call esoteric. We hardly see them, you know what I mean? And so you will have to ask your doctors to focus on those things. But the most common ones within the Caribbean, New York, Miami, and Florida that we see in Black people, we do general checks for those on a yearly basis. Again, and the reason why we screen for those disease entities, because they're very common, and it's important to understand that if we pick these up early, we can cure you of those diseases. A couple markers they have for lymphoma and these very things. And people always curse me all the time, but why you didn't go and look for all of it? Because those are not very common. Very rarely we see these disease entities. So we try not to look at these. We look at the ones that are more common. I mean, you know, your high blood pressure, your diabetes, your cholesterol, Barry. I don't know which one is up, but you know what I mean? We need to check. He asks you which one is it, is the good cholesterol or the bad cholesterol. Majority of the times, I look initially, you don't do the good, but you look at total cholesterol, and if it is up, then you break it down into your, you know, your HDL and LDL, and you try and figure out which one it is.
Boss is on top of things.
And then some of the times, you know, when these diseases are high and common, the treatment options are not something to our liking, and people just take it for a little while. And I hate when a man come in to me and say, you're telling me he has high blood pressure and you put him on medicine. And of course, if the medicine didn't work, your blood pressure wouldn't have come down. But yes, your medicine work, your pressure come down, and then they stop taking the medication and they're gone. And of course, what happens? The blood pressure goes right back up. And then you go back on the medicine, and some of them only take it when the blood pressure up. I say, you have to be consistent. It keeps it down. Your blood vessels are like copper wires. It goes up and down, up and down. If the copper wire go up and down, what happened to the copper wire in there? It does break. Same thing with iron voice. If the iron, you're bending the iron up and down, well, after a while it breaks. And when it busts open, you bleed, and then you end up with a stroke, or even if you throw a piece of clot, a piece of the tissue that break off of that vessel, goes and block one of your blood vessels, you have heart attack, you have stroke, you have dry and wet strokes, and you get different bleeds. So we need to understand that we need to be consistent, what we call compliancy. Okay, being compliant becomes important to us, but we so casual and we so cool. Boss, I take the medicine and my blood pressure come down, so I stop. I'm say check up now when the pressure high. The same thing with the diabetes. You give them the medicine to take, and they say, "Big man, why my sugar good, money good." When you go check it now, they're 500, 600. I had a friend the other day losing weight for 2 years. Barry, we were over in Barbuda the other day. One of the guys that put on that fat, he losing weight, and I keep telling boss, go and check. Even after that event, when we did that event last year, I saw him at the event. I said, boss, something wrong. Go check. The other day, the man come to my office, Barry, and I'm glad we could talk like this, right? Because it came to my office and his sugar was 600 and something. He's spilling stuff in his urine and everything. And for 2 years now, I tell this man to go and check. And the man going on like it's cool. I said, boss, leave what you're doing now and go back to the doctor. Get some insulin, drop down everything, and no, he back on track. He's doing good. But I'm just showing you how easy it is to be sick and don't even know, because again, as men, thank God you all have wives who telling you all to go and do so. But the poor man out there who ain't got no wife,
it's true.
He got nobody to tell him to go check up. You understand? And we just do these things as Caribbean people, and we're so accustomed to just wake up and move and do our lime and everything, and don't worry about nothing. And you know, so these diseases out there for men's health, it becomes important for us to understand.
That is why I wanted to do this, because the fact that you bring it up with somebody in the entertainment realm, no symptom. Well, I mean, he having the symptoms, he having problems urinating and all that, but he's still going and he's still out there and he's still, you know what I mean? So this is what I'm trying to drive home here, Doc, is how could we change the narrative? All right. So far we get with in terms of traveling, we need that minimum 6 to 8 hours rest, right? Nutrition is a major part of it. Hydration, Gatorade, all these things. But in terms of now the regular checkups, like with the colonoscopy, when you're talking about prostate, all these different things, you get your regular check. But in the entertainment world, like I Am Voice, in a party, drinking, all right? How could he alternate that lifestyle so that he is good? If you understand what I mean. Is it drinking in moderation, or in terms of, you know, they have this thing in the thing where they will tell you, all right, if you take a drink, we just take 1 drink, 2 things of water.
2 glasses of water with 1 drink.
I don't drink, so I trying to, right? But Barry had a point.
Yeah, because a good friend of ours, for example, Alexander the Great, we'll leave it at that.
Yeah.
He now used to drink juices as a mixer. Now he will do soda, or he will do water as his mixer with his vodka. So he took one step to say, okay, I know I'm going to have 3-4 drinks, you know, for the night, rather than mix it with juice, i.e. cranberry or one of these, which is high in sugar. I'm going to mix it with soda water, so I get a little bit of fizz, but a lot less sugar. So
real informative, y'all. Real good, and I hope you guys took a lot away from this. And if you didn't, and if you want to follow up, feel free to email me at fusionlife2020@gmail.com. But we are going to have a part 2 to this. We have to have a part 2 to this. So I want y'all to keep it locked right here. It's been real Dlife, y'all. Peace and love in the streets, y'all. And we'll have part 2 to this. Because God done there is so much information, man. All right, Dlife, we out. Happy holidays, everybody.
Sweet silver bells all seem to say, throw cares away, Christmas is here, bringing good cheer to young and old, meek and the bold, ding dong ding dong.